Upper respiratory tract infections. Overview. Upper respiratory tract infections URI or URTI are the illness caused by an acute infection which involves the upper respiratory tract, nose, sinuses, pharynx or larynx. This commonly includes tonsils, windpipe, nose, ear infections and the common cold. Most URTIs are due to a viral infection. Causes. These infections are caused by different viruses and bacteria. The most common virus is called the rhinovirus. Symptoms. Cough is usually the main symptom and the other symptoms include stuffy nose, nasal discharge, sneezing, runny nose, sore throat, painful swallowing, fever, general discomfort, fatigue, weakness and poor smelling sensation. Recovery. Symptoms gradually reduce after 2 to 3 days, but the cough may persist for about 2 weeks. Food and nutrition. The foods which can be taken include fresh organic vegetables, animal products rich in vitamins A and D, foods rich in vitamin C like fresh and dried herbs, green chilies, broccoli, cauliflower, Brussels sprouts, guavas, strawberries and papayas are to be taken. Ginger teas can cause relief from common cold. Having a combination of lemon juice extraction and honey in warm water is one of the most effective natural remedies for respiratory infections. Drink plenty of warm water so as to replace the fluid that you have lost, and at the same time try to have hot herbal teas. Foods to be avoided. Avoid foods that weaken the immune system like alcoholic and caffeinated beverages and tobacco. Foods having a high fat content. Limit intake of citrus foods like oranges, grapefruit, mandarin, lemons, pomelo and citron. Hot and spicy foods. Dairy products like cheese, milk and yogurt. Refined and processed foods like chips, cheese snacks, sugary breakfast cereal, canned foods, frozen fish, etc. Exercise and yoga. Follow a weekly exercise regime consisting of a balance between aerobic exercise, bending and stretching exercises and strength building exercises. Yoga. Pranayama, an important aspect of yoga, helps in strengthening the immune system. Prevention. Some preventive measures to reduce the infection include: get vaccinated with flu vaccine, reduce contact with people who have the infection, properly clean the objects that are touched by the infected individuals, cover mouth and nose when coughing or sneezing. Unless ventilation is good, avoid shared space with people who are ill, as these infections spread through tiny droplets. Wash hands regularly before meals and after direct contact with potentially contagious people, animals, blood secretions, public places and bathrooms. Do not share drinking bottles, cups, towels, etc. with other infected people. Avoid getting cold and wet. Consult a doctor if symptoms do not start to ease within a few days, or if you suspect that a complication is developing. If fever, wheezing or headaches become worse or severe. If you develop fast breathing, shortness of breath or chest pains. If you cough up blood, or if your sputum or phlegm becomes dark or rusty colored. If you become drowsy or confused. If a cough persists for longer than 3 to 4 weeks.